Hi, welcome to Medical Monks, where your care is our highest calling. I'm Nikki, and today we're going to take a look at a product from our partners at HR Pharmaceuticals. A couple of hundred years ago, we didn't know anything about the stuff that is on our bodies. We didn't know about germs. We didn't know about viruses. And if you had a surgical procedure then, in the good old days, you had a chance of dying somewhere in the odds of 70 to 85%. So the whole point in this is we are cutting down the rate of post-op infections or surgical site infections, SSI for short. And as you may or may not know, things like MRSA and hospital-acquired infections are actually on the rise. So this is something we're doing as a preventative frontline defense against that. At your pre-op appointment, your clinician or your nurse is going to send you home with some instructions for how to take care of yourself in the days leading up to your procedure. Things like your proper nutrition and hydration, and also, more importantly, hygiene and how you're going to bathe leading up to and the day of your procedure. This is CliniClean. It's a solution and a detergent that contains something called chlorhexidine gluconate, or CHG for short. So the whole point of this particular ingredient is it adheres to the skin, and on contact within 10 seconds begins to start to destroy all of those things, or microbes that are living on our skin. Now give that 10 minutes and it's even decimating more of that population. At the end of an hour, it's virtually removed almost 99%, according to studies, of those things on the surface of your skin. Now, how are you actually going to apply this? Clinicians and nurses, the instructions they give are going to vary a little bit, so you would always want to check with your clinician. But generally speaking, it's okay to shower and to shampoo with the things you would normally use. And after you're thoroughly rinsed off, you would go ahead and apply the detergent to your body for about 2 minutes or so. And it's actually recommended that you use a hand or some kind of a sterile cloth. You can find those on medical websites as well that are already contained in a package. At any rate, you're going to leave it on your skin for about 2 minutes, rinse it off, do that process again. You would start from the neck down and pay special attention to wherever that surgery site is going to be. So if it's something on your abdomen, you're going to focus there. If it's on your neck, you're going to focus there. For instance, a child, it might be something you actually wipe on and you would dab off with a dry towel as opposed to doing it in a shower. So all kinds of ways you're going to use this. Again, make sure you check with your clinician. Where not to put it. We don't want it coming in any contact with any kind of mucous membrane or any open areas of our body. So no ears, nose, mouth, your genital areas. You just need to be very clear that that stays away from those areas. Now, other areas that we may actually use this for are, if you're a clinician yourself, you are going to use that for pre-op hand washing. If you are a home clinician and you're going into the home setting, this comes in a very convenient little packets that you can toss in your bag with you and use right at the patient's home before you start to take care of their needs, change wound dressings, catheters, whatever you're doing. Of course, being careful to put gloves on afterwards, not touch anything before then. So we talked about the fact that they come in a couple of different sizes and applications, and one of those is a foam, of course, which is great for hand washing and no mess. I'm a big fan of anything that comes in a foam because you're not wasting any of the product. It goes directly where you want it to, stays on your hands or wherever you're putting it on your body. Of note is that it comes in different sizes to be applicable for either a facility setting or multi-use. This is generally not something you want to share with your family. And under the circumstances, most likely it's going to be a single use, one patient in the home. And so the flip top bottles, the 8 and the 4 ounce, are probably what you're going to be getting familiar with. Thanks for giving me some time. If you found any of this content helpful, please be sure to go ahead and like and subscribe below.